Hi everyone, this is Dr. Delaney. I'm a facial plastic surgeon practicing in Houston, Texas, and I'd like to go over a case study of a patient in her early 20s for whom we performed a rhinoplasty and chin implant augmentation. So I'll go into her before and afters to show you what kind of our thought process was around the time of her surgery. Starting out here, we have a view of her profile or a side view before and after, and she is shown here on the left before surgery and on the right about a year after surgery. So we have a nice long-term follow-up. Some of her initial concerns included her dorsal hump, the elevation of her nasal tip, which when she smiled actually pulled down even more, and the size of her tip here. So her bridge and her tip kind of all blended together, and so she wanted a little bit more definition. She wanted a little bit more of a slope profile. And let me show you in the front view here. On the front view, she was concerned about the curvature of her nose, which curved a little bit to the left, and that corresponded internally to a deviated septum. She also had some trouble breathing, and internally her inferior turbinates were enlarged, so we made sure we were going to treat that as well. She also wanted to reduce the size of her tip to refine it a little bit. Now lastly, she also didn't like the size of her chin, and she wanted a little bit of augmentation with a chin implant. Now, as a facial plastic surgeon, the way we look at the chin and determine whether your projection is appropriate or not is assuming you have good occlusion and you don't have any jaw developmental abnormalities. We look at this line that's a straight shot down from where the pink lip and the white lip joins. And for women, we ideally want the chin projection to be about 1 to 2 millimeters behind this line. For men, it could be past this line. Men can have stronger chin because that's masculine features. For women, we generally want to make sure that they don't go past this line. In fact, when performing chin augmentation, we may err on the side of going under just so we don't over-masculinize a patient. So the chin projection is very important when you're thinking about facial harmony or proportions from the side. A small chin will make a nose appear larger. So if the patient doesn't like the size of his or her nose, in addition to making a nose smaller, we can make the chin a little bit more projecting, and that will give us better balance, and it'll be more pleasing, more harmonious when looking at the face and the chin as a unit from the side. So starting with the after in the on the profile view, you can see we gave her a nice little sloped bridge, which is what she wanted. Her nasal tip was lifted up, refined slightly. We didn't have to excise a lot of cartilage. It was more about folding it and using sutures. And we also partially resected this muscle, the depressor septi nasi muscle that pulled down on her tip every time she smiled. Now for our chin implant, we used a small incision right underneath the chin here where the chin and the neck joins. A lot of people will have a little crease there. So we placed that chin implant through that incision, and then usually heals up really well. Now returning to the frontal view, we got her nose straighter. We performed osteotomies to narrow the base of her nose to make the nose more narrow. We used cartilage grafts called spritter grafts to reinforce her nasal airway internally, also to create a more pleasing dorsal aesthetic line. As mentioned, the nasal tip was refined and lifted slightly, but still very natural. And most importantly, we preserved nasal cartilage structure here, so long-term wise, breathing is going to be great, and it's not going to collapse. It's not going to get alar retraction, where sometimes we see it overly resected tips. Internally, we also corrected her deviated septum, which was off to the left. We also trimmed her inferior turbinates to create more space to improve her breathing. This is a nice long-term 1-year follow-up. Our patient's very happy, and thank you for your attention, and I hope you found this clinical case helpful.